A very good evening and a warm welcome to all our esteemed guests and to dear learners. I'm Dr. Riya Tukral from the Homeopathic Academy, and we are here today to discuss a very interesting topic with Dr. Saptarshi Banerjea. We have Dr. Banerjea live with us right now. But before we go ahead with this webinar, as it is customary, let me introduce the Homeopathic Academy to you all. Just give me a second and I'll give you a quick introduction to what we are and what is the Homeopathic Academy. So, the Homeopathic Academy, or THA as we call it, is BGen's effort towards digitalizing homeopathy and providing a platform for quality education online. THA offers you a range of online courses by well-known academicians on numerous subjects of homeopathy at UG, PG, UPSC and CME level. All these courses are enriched with state-of-the-art audio-video technology, text and vector animations, giving you an HD quality audio and video experience made by a dynamic team of qualified doctors, video editors and many more professionals. These courses will perfectly complement your studies to make learning an extraordinary experience. On your screens, you can see some of our courses currently streaming on our website, www.thehomeopathicacademy.com. You can also see the course on learning the art of rapid classical miasmatic prescribing by Dr. Saptarshi Banerjea. Let me quickly breeze through the courses that we have to offer in homeopathy of homeopathic subjects and allied subjects. You can see a few of our best-selling and the courses from all over authors from all over the world. This is the course on learning the art of rapid classical miasmatic prescribing by Dr. Saptarshi Banerjea. Here, Dr. Banerjea will teach us how to include miasms in our homeopathic prescriptions. He ensures that with proper application, miasmatic prescribing can uproot the underlying cause of disease and nip the bud of increased susceptibility to future diseases as well. So don't miss out on gaining the wisdom. Enroll in Dr. Banerjea's course at our website. Also, you can see some more courses by brilliant authors. Just quickly breezing through them, not taking much of your time. So this is the latest course that we have, Miasms of Acumen by Dr. Faruk Master, and some practice of medicine courses for your learning. So that's it. Thank you so much for listening. Coming back to this webinar, since we already have Dr. Banerjea with us, let me quickly introduce Dr. Banerjea to you all before we start with, the presentation and gaining the wisdom from him. So, Dr. Saptarshi Banerjea, he is a brilliant author and a clinician. He inherits his clinical acumen and wisdom from his illustrious father, Dr. Subrata K. Banerjea. Being the fifth generation homeopath, Dr. Saptarshi has inherited the wisdom and homeopathic heritage of over 100 years. He finished MD with specialization in Materia Medica. The Calcutta Homeopathic College awarded a gold medal for his first position in All India MD entrance examination. He holds postgraduate workshops in Malaysia, Bangkok and Tokyo. He is a lecturer at Allen College of Homeopathy, England, Bengal Allen Medical Institute, which offers international programs for overseas homeopaths frequently. You can also see some books and some articles that Dr. Banerjea has authored on your screens. Just a quick glimpse about our esteemed author today. Thank you so much, sir, for being here with us.
Thank you.
So, sir, before I hand over to you and we start learning, let me quickly explain our learners how this interface works. So, all of you, you have a short chat box on the right-hand side panel of your screens, and you can type your question or whatever message you have for Dr. Banerjea right there, and press the button next to it to send it to us. I request you all to send your questions only after Dr. Banerjea's lecture is over, as that might disturb him and we wouldn't want that. So without wasting any more time, let's start learning. Over to you, sir.
Thank you very much for the introduction. We have a very interesting topic today. It's about a comparative Materia Medica of a case of an infected adenoma, infected ulcer. And as you know, as you understand, I've always tried and prescribed on the Materia Medica and trying to differentiate remedies, not from a repertorial point of view, but from a Materia Medica point of view. So that is one of the primary understandings of prescribing the remedies. And without further ado, I'd like to share or start with our interesting case. This is an interesting case of an infected adenoma or infected lipoma, where the patient came to us with a certain set of symptoms. And if you try and understand the miasms, adenoma is generally psychotic. But whenever it's an infected adenoma or whenever there is oozing from the adenoma, that makes it syphilopsychotic because there is syphilitic component due to the suppuration with the adenoma. So that is one of the factors. Now, with this interesting case, this was a young woman, or this was a woman of 47 years old. And this was the first picture. So if you can see here, it's a huge adenomatous swelling on the left shoulder. To be honest with you, when I saw this initially, it looked malignant. That's why I had advised for a biopsy or FNSE. And thankfully, it was benign and it showed adenoma, which was the findings. The size is quite huge, and you can see in the middle there is the opening where there is oozing of discharge and pus as well. So she applied some topical ointments and cream when she came for the first visit because of the chances of further infection to minimize. Non-healing ulceration from the left arm. Interestingly, it was a thick yellow discharge. So if you think of adenoma, as I shared with you, it's psychotic. But whenever there is oozing from it, suppuration from it, it makes it syphilopsychotic. Thick yellow discharge. Again, yellow is the color of psychosis. And thick again is psychotic as well. If you try and differentiate the miasmatics of discharges, soric discharge is thin and watery. Psychotic discharge is thick and yellow. Where syphilitic discharge is offensive and stringy. As tubercular discharge can be hemorrhage, bleeding. So each discharge, whenever you're trying to understand, even before trying to compare the remedies, it's a very good idea to compare the miasmatics initially. Thin, watery is sora. Thick, yellow, profuse, fishy odor is psychosis. Whereas offensive, stringy discharges is syphilitic, and hemorrhage from any discharge is generally tubercular. So this woman had this huge adenoma with a thick yellow discharge, very debilitated, exhausted. Could be due to the extent of the discharge coming out. Tingling extremities more in the left side, left-hand fingers, could be due to some pressure effect of the adenoma as well. The left-sided adenoma and the left fingers, there is tingling as well. Could be because of that. And I had done her blood sugar levels, which are normal considering the debility, considering...
Sir, I'm so sorry to interrupt, but we can't see the slides that you're sharing. There's some issue in it, I think.
Okay.
Shall I start the slides from the
Yeah,
room
please.
itself?
Yeah, that will be better, I think.
Yes, now we can see them. Your
Perhaps I'm not. If I'm changing, it's not being visible. Maybe it's. I think it'll be better if you share it, please. Should I turn the screen share off? Was this visible? The picture?
Yes, sir, it is visible. So the present complaints.
Yeah, you're sharing it, right?
Yeah, sir, we'll do that. You just say next. We'll do that.
Okay. Yeah, please. Okay. So when I was sharing, was the picture visible then?
Yes, sir.
When I was sharing, was the picture visible? The picture of the woman?
Sir, in the starting it was not visible.
Now the slides are visible.
Yes, sir.
Okay, can you go back to that, please, if you can? To the previous slide, yeah. So you can see the huge swelling with the left arm, and she applied some topical ointments to minimize any chances of further infection. So the huge swelling is psychotic, and the oozing from it makes it syphilopsychotic. So whenever you have more specified symptoms to differentiate the miasmatics, it's always better to prescribe on the basis of that. So in this case, you have the oozing, which is more syphilitic, and obviously the adenoma is there, which is psychotic. So consider that when you're trying to dissect the miasms. Could you go to the next slide, please? So the present complaints, as I mentioned, was a non-healing ulceration, thick yellow discharge. I shared with you the miasmatics of discharge, debility, tingling extremities, left fingers. It could be as a result of the pressure effect from the adenoma. So there was a lot of tingling in the left hand. I had done her blood sugar levels, which showed didn't show any abnormalities, considering the debility, considering the neurological symptoms. And she had quite a lot of joint pains as well. Couldn't mention specific modalities, just a night aggravation. So those were the existing complaints with her. Now, this is an interesting symptom. As we're going along, I'd like to share some comparative differences. Whenever you come across cases of tingling extreme hands, especially in the left hands and left fingers, sometimes whenever a patient tells you that I have a lot of tingling, numbness in my left hand, if it is as a result of angina pain, patient has had a history of cardiac disease, or there has been a myocardial infarction in the past, and there's a lot of numbness and tingling which is radiating down to the left arm, do always think of a very wonderful remedy, Latrodectus mactans. Latrodectus mactans is prepared from the spider. And if you open Borica's Materia Medica for Latrodectus mactans, and you'll see it's mentioned that there is tingling and numbness in the extremities as a consequence of due to the cardiac involvement. I'll just read that part. Latrodectus mactans in Boricae, constriction of chest muscles with radiation to shoulders and back. In the chest section, violent precordial pain extending to the axilla and down the arm and forearm to the fingers with numbness of the extremity. And because it's the cardiac involvement, it generally radiates down to the left arm, where there is a lot of numbness and tingling. which is very classical for latrodectus mactans. So you come across cases with cardiac involvement and there is radiation of the pain down to the left arm and fingers. It's always latrodectus mactans. 30C200C works. Now, doing a comparative Materia Medica, you come across cases where you have a cervical pain, a neck pain. Along with that neck pain, there's a compression effect between the vertebra, and that is causing the pain radiating down to the left arm and fingers. And you'll have that with Paris quadrifolia. If you open your Boricae for Paris quadrifolia, you will see it's mentioned in Paris that there is that tingling and numbness. I'm just reading this from Paris quadrifolia. Neuralgia beginning in the left intercostal region, extending the left arm. Numbness of the upper limbs. Fingers often feel numb. Again, it's especially the left side as well. So cardiac ailments resulting in radiation of tingling and numbness down to the left hand. That's latrodectus. But whenever you come across cases where there is cervical pain which is radiating down to the left arm and fingers, that is definitely Paris quadrifolia. And in both of those cases, please consider using higher potencies because it's more neurological in origin. Next, please. Head to foot assessment, again, not much. Occasional vertigo, rising aggravation, hot sensation on the vertex. This is classical. You have that in calcarea, you have that in sulfur, you have that in graphitis, you have that in lachesis. So those are a few of the polycrests which have a hot vertex. Sometimes you'll hear patients telling you that. Frequent redness of eyes with watering. If you recall the miasmatics of redness of eyes as generally tubercular. If you recall, I've shared this in earlier sessions as well, that congestion is always a tubercular manifestation. And whenever it's inward congestion, you'll find redness. So, the skin looks red and flushed, or there is redness of the eyes. That's an internal congestion. And sometimes you'll come across cases where there is an external manifestation of congestion, which is bleeding. So that you can find with many remedies as well. So redness is a common tubercular manifestation. You have that with sulfur, you have that tuberculinum, redness of eyes. Salivation during sleep is interesting. Top remedies for salivation. Again, doing a quick comparative Materia Medica. You have that definitely with Moxol, mercury. You have that with lysine, where there is profuse salivation. You have that in Dulcamara as well. In Dulcamara, all the discharges are increased. So there is profuse salivation in Dulcamara as well. Tyalism is the word in Dulcamara. So those are few remedies. You have that with profuse salivation. Lysine, Dulcamara, Merxol, and then a very interesting small remedy, if you manage in Boricae, have a look, is granatum. Granatum is a remedy for worms with worm infestation with salivation. So there's a lot of worm infestation. Along with that, there is salivation, and that's a fascinating feature of granatum. Granatum, granatum. So those are about your salivation remedies. And sometimes you'll come across cases where there is a tendency to spit. So patients, like children especially, they go about and it's like a disgusting behavior where they're spitting everywhere. And that tendency to spit is another fantastic remedy called Epiphagus. Epiphagus is a remedy where you can have either a migraine with profuse formation of saliva, or you can have a constant tendency to spit in Epiphagus as well. That's a very interesting clinical tip. You'll find that in Boricae for tendency to spit. Another very useful remedy for another salivation is lactic acid. And in lactic acid is mostly due to a lot of water brush regurgitation, which is causing salivation. So it's more like a water brush and formation of saliva in the mouth in case of lactic acid. So those remedies can help you counteract salivation. So those were the head to foot assessment. Next, please. Generalities, appetite was quite poor. It could be due to the weakness combined with that. Thirst is less. Stool quite offensive with a lot of mucus. A lot of profuse sweats, perspiration on neck and face. Mucousy stool, I like to share a few comparative Materia Medica, small organopathic remedies. I've used with very good results, and I want you to have a look later on in Borike, is Chaparro, Chaparro, Chaparro amargoso. Chaparro is a remedy which is a small remedy. India is a common country where you'll find a lot of mucus colitis cases. Either it could be amoebic dysentery, it could be bacillary dysentery, where dysentery is a very common ailment to the length and breadth of the country. And Chaparro is a wonderful medicine. And the indication for that in Chaparro is where you come across cases of stool with little pain but much mucus. So there's not that degree of tenesmus which you'll find with mercury. A remedy like mercury, there's a lot of tenesmus, there's a lot of rectal spasm, but in case of Chaparro, there's not much rectal spasm, but there is a lot of mucus formation. So little pain but much mucus, that's a very classical indication for Chaparro amargoso. So mucus colitis, dysentery, Chaparro works really, really well. Second remedy for mucousy stool is aloe socotrina, aloe, A-L-O-E. N.M. Chaudhary mentions this in his Materia Medica, that if you write a Materia Medica without aloe, it is like writing a novel without a hero. So if you're writing a Materia Medica, if aloe soc is not there, it's as good as writing a novel without a hero. So aloe is a small but very important remedy where you have jelly-like lumps of mucus. So sometimes the patient will tell you, I'm not passing stool, I'm just passing lumps of mucus, which is very, very classical for aloe socotrina. And the second important factor for aloes is you'll find cases where there's absolutely no control of the anal sphincter. So lack of control of the rectal sphincter. They're telling you that, whenever I get the urge for stool, I have to rush to the loo. So two factors for aloe as an acute for mucus colitis is jelly-like lumps of mucus, and there is no control of the sphincter and insecurity of the rectal sphincter. That's very classical for aloes. And thirdly, my top three, as I shared with you, lesser known for mucus colitis. I shared with you Chaparro, I shared with you aloes, and the third is Holariana. That's a famous Indian drug. You'll find in the Indian drug section of Borike, Holarrhena, Holariana antidysenterica. Holariana, you can understand by the name, it's a remedy for dysentery, antidysenterica. And it works really, really well whenever there is a lot of abdominal cramps along with rectal spasm for diarrhea as well as dysentery. You can use that in tincture, you can use that in 6C. Those are very useful remedies for mucus colitis. Coming back to her case, perspiration, profuse, hot, desire spicy and salty was not very marked though. Sleep is poor, she wakes up very, very unrefreshed. Next, please. Couldn't get much mental generals, to be honest with you. Aversion company, there's a lot of anxiety, fearfulness, palpitation, poor short-term memory. Again, if you go back, please. Again, if you understand, sometimes in the COVID world as well, anxiety is a very common problem. And this, you'll find a lot of people sharing this with you, that whenever I'm getting anxious, there's a lot of fearfulness, there's a lot of panic, there's a lot of palpitation, what she mentioned. And a very useful small remedy I'd like to share with you, if you have a look in Borike, Scutularia. Scutularia is a small remedy, but very useful in those cases where you come across with a lot of fearfulness, a lot of palpitation, a lot of anxiety. And I'll read Scutularia from Borike to try and share with you the understanding. Nervous sedative, nervous fear predominates, cardiac irritability. So even I've prescribed in post-COVID cases as well, where there is a lot of panic, a lot of anxiety. Along with that, there is palpitation as well. So that those things go hand in hand. Sleep is poor, so it's a nervous sedative. Weakness, nervous weakness after influenza. You'll see it's mentioned in the introduction in Borike. So all those factors come really handy for Scutularia laterifolia. You will see in the sleep section, night terror, sleeplessness. So you have the combination where it affects the heart, palpitations, due to anxiety, due to fear, due to after a major acute illness. Along with that, the second side, the sleep is affected, so there is insomnia. And the third side, you understand there's a general debility as well. And the general debility, the general weakness could be reflected on the sexual plane as well. If you look in the male section, it's mentioned seminal emissions and impotency with a fear of never getting better. So there is that anxiety, there is that fear, which is affecting the sleep, which is causing the palpitations. And that is a very useful prescription for prescribing scutellaria. And sometimes in case of migraine in very anxious personalities, if you look in the head section of scutellaria, migraine, worse over the right eye, explosive headache of school teachers with frequent urination, nervous sick headache, worse noise, odor, light, better rest, 5 drops of tincture. So sick headache, nervous headache, explosive headache in school teachers with polyuria and scutellaria can help you. Again, the personality is important there as when you're prescribing as an acute. The personality of an anxious, fearful disposition. So that is quite common. That was quite common with her as well. Poor short-term memory. Memory is quite weak with her as well. Next, please. Interestingly, if you try and understand the prescription of the case, you understand there are not much characteristics to prescribe on. But I'm sure day in, day out, we come across cases where there is lack of peculiarities in case, and the pathological generals do become important in those cases. With the ulceration, with the adenoma, there's a thick yellow discharge. Now, if you think of a remedy which has a thick yellow discharge, and there are features of calcaria. What are the features of calcaria? Anxiety, fearfulness, palpitation. You know, the 3 A's for SORA: anxiety, alertness, apprehension. Paddington mentions this in the clinical Materia Medica, that whenever somebody tells you that of all the fears under the sun, it is definitely calcaria. Debility. There's a line in Boricae for calcaria carb: exertion produces a jaded state. Calcaria always overworks themselves, but they're easily tired. Profuse perspiration, neck and face. In the upper part, calcaria always sweats more, wets the pillow. Hot vertex, as I shared with you, calcaria has that as well. Next, please. Now, if you see features of sulfur, hot person, desire for spicy. Sulfur likes spicy food with a lot of chilies. Offensive stool, all discharge sulfur offensive. Mucus. I was taught as a clinical tip as well, whenever you come across cases of chronic mucousy stool, which is so common in the subcontinent, do always remember sulfur works wonderfully well with few sulfur symptoms. 30C is the choice of potency. I repeat, chronic mucousy stool with, you know, patients in the 40s and 50s, they will tell you since they have been young, they have had mucousy stool with few sulfur symptoms. Sulfur 30 always works best to start those cases. Hot vertex, frequent redness of eyes. I mentioned that sulfur tuberculinum has that. You know, you come across cases of iritis, you come across cases of conjunctivitis, where there is a lot of recurrent redness of the eyes. You always follow that plan of sulfur followed by tuberculinum. That works wonderfully well. So you see, you have the feature of calcaria sulf, which is a thick yellow discharge. You know, 2 factors whenever you're considering prescribing calcaria sulf is after pus has found an opening. If you can go back to the first picture, please. The earlier picture, please. Thank you. You see the adenoma, there is the opening of the adenoma. So after pus has found a vent, that's a very classical indication for prescribing calcaria sulf. That's why there's not much degree of pain. I'll come to the comparative Materia Medica later on. But here the pus has found a vent, found an opening. A. B. The discharge of calcaria sulf is always a thick, yellow, lumpy discharge. It's as if when you're pressing the toothpaste, the discharge which comes out, it's an exact similar replication of that. So thick, yellow, lumpy discharge, that's very, very characteristic of calcaria sulf. Now, if you go back to the slide, please, on the totality. Thank you. So now with this totality, with the thick yellow discharge, you have features of calcaria, you have features of sulfur. And that's why the prescription in this case was calcaria sulf. Now, sometimes you may think that how can we prescribe on features of one remedy, features of other? And this has been mentioned classically very, very, very many times by Master Kent, that whenever you have features of two great polycrests, you can always combine that features and you can prescribe that remedy. He mentions that in ferrum phos. He mentions that in natrum sulf. Features of ferrum, features of phosphorus, you can prescribe ferrum phos. Features of natrum, features of sulfur, you can prescribe natrum sulf. Similarly, whenever you're prescribing calcaria sulf, you can have features of calcaria, features of sulfur with the thick yellow lumpy discharge. And that's very, very classical for calcaria sulf. Next, please. The choice of potency to start with was 30C. Why 30C? Because there was not much emotionals. It was much physical. The prescription based on physical symptoms. We started low, 30C. There's not much change with 30C. I generally follow up the patients in 6 to 8 weeks' time. There's not much changes. I went higher up to 200C. She came back again in 7 to 8 weeks' time. She mentioned the discharge from the ulcer was still thick yellowish white. Appetite was quite poor. Repeated a 200C again. Now, whenever you are stuck with the understanding of potencies, there's a wonderful chapter in Kent's lesser writing, series and degrees of potencies. And Kent mentions there that whenever you are confused with potencies, do follow that Kentian octave. You start off with 30C. You can prescribe 2 doses of the same potency. You can go higher up to 200C. Again, 2 doses of the same potency. Again, to 1M. Again, 2 doses to 10M. So 30, 200, 1M, 10M, 50M, CM, DM, MM. That's the Kentian octave. Obviously, the highest potencies may not be available in today's pharmacies. DM, MM potencies are very rarely available. But obviously, up to CM potencies can be available. So you can always go higher up the chain in Kentian octave. Repeat 2 doses of the same potency in a definitive interval of time, depending on how the patient is improving, and then go higher up to the next potencies. And Kent also mentions you can drop down as well whenever you're going down the scale. So both can be done whenever you're prescribing. I saw again in August, and that was interestingly, the ulcer had gradually started to reduce. The discharge was better, but it was sometimes oozing. The joint pains were quite persistent, long continued sitting, and sometimes the joint pains related with gastric issues as well. Due to flatulence, there was the back pain, stool was unsatisfactory. But one interesting thing was the generals had improved. Appetite was poor in June. In August, it had started to be better. Next, please. I'd given 2 doses of 200C. When I saw in October, she mentioned that the adenoma had improved, but now it was standstill, that they were still discharging, and the finger tingling was there. There's a cold sensation. Again, if you think of coldness, calcaria has the coldness. So I was still quite firm on continuing with calcaria sulf as there's still calcaria symptoms in the case. Heaviness, bloating. You understand with any psoric remedy, you can have the bloating because of lack of peristalsis, lack of enough digestive movement. So there was that bloating which was there with calcaria sulf because of calcaria and sulfur features. It's a king. If you think of calcaria, sulfur lycopodium as Hahnemann's triumph antisoric. So sora causes that bloatedness, sora causes that lack of peristalsis, which is important. So I went to a 1M in October last year. December, it had reduced even further with the 1M. And there's still some degree of tingling. Appetite was better. Gastric issues were coming back off and on. But as her major concern was the adenoma, and that was better, so we prescribed placebo then in December. March, she came back after another 2.5 months, and I prescribed another 1M as there was again improvement, but there was standstill again. You see, whenever the patient is improving and then there is a standstill, you can always repeat the same potency and always go higher up or lower down the scale. So it's always a very simple dictum for the time of repetition. I've been asked in many webinars that what potency to give, when to repeat. You cannot ever say when to repeat the remedy. It depends on how the patient is improving. It depends on how the patient is responding. It's not a mathematical calculation that you repeat every 3 weeks, you repeat every 4 weeks. It's absolutely illogical to ask that question even, because whenever the patient is improving, you wait and watch. Is a standstill condition, you repeat, you go higher up, you go lower down. That's the exact dictum, not by me, Kent's lesser writings, series and degrees of potencies. So March was the last prescription, 1M. Next, please. You see that gradually the arm has started to shrink. You can see there is not much pus there at all. The pus has completely dried up. The adenoma has gradually started to decline as well. So that kind of a huge swelling starting to gradually come down is obviously a wonderful indication of the remedy. Obviously, as I mentioned, she's continuing the treatment. So there has been a good deal of improvement. She previously mentioned she was not being able to wear long-sleeved clothes, but now she has been able to do it as the size has reduced almost to 60 to 70% of what it was. So that's also a very good change after the medication, which is interesting for this Calcaria salve. Next, please. Now, whenever you try and compare the suppurative process, it's always important to understand and analyze what are the related remedies. As I shared with you for Calcaria salve, it's a condition after pus has found an opening. And secondly, for Calcaria salve, as I shared with you, that the discharge which is coming out is thick, it's yellow, it's lumpy. So those factors are always important for prescribing Calcaria salve. Now, when you compare it with related remedies, whenever the pus hasn't found an opening, and you'll find there's a lot of sensitiveness. So the initial stage is obviously the belladonna stage, the early stage, before pus forms, congestion, redness, heat, rubor, dollar tumor. There's burning pain, there's sensitiveness of that part. Touch aggravates, heat ameliorates. So it's always the initial stage of any kind of infected condition, not just this case, but any kind of infected condition, be it acute, be it chronic. It's always a belladonna stage is there, definitely. Where there's redness, where there's congestion, where there's heat, sensitiveness, burning, touch aggravates, heat ameliorates. Now, after the belladonna stages, always a Heper stage comes up. Whenever you find there's an opening to the pus has found an opening, but it's not coming out, pus is about to form or has been formed. What is common with belladonna and Heper? You'll find the sensitiveness in both. Belladonna is sensitive, Heper is sensitive. Both are better by warmth. Both are worse from cold air. But what is interesting and differentiating factor, so if you think symptomatically quite similar, sensitiveness, better from warmth, worse from touch, Heper salve will faint from pain. But what differentiates is the pathology. Belladonna doesn't have any suppuration, but whenever it's a stage of Heper, there is suppuration. It's underneath. It's still not coming out. And that's why the sensitiveness. You see, that's why I mentioned third or fourth line in Heper. Heper acts on abscesses before they open. So that's why when the abscess hasn't opened, think of a fistulous condition, think of a boil, think of an abscess where there's pus inside, there is a sensitiveness. Heper acts on abscess before they open. Calcaria salve acts on abscess after they have opened. So whenever it's draining, whenever it's discharging and there's a thick yellow discharge, it's always the stage of Calcaria salve. So after belladonna, you can get a stage of Heper salve. But obviously after Heper, Calcaria salve can come in because it's after the pus has found an opening in case of Heper salve. Now sometimes when the pus has found an opening, it's a thick and yellow calcareous sulf will definitely come in handy. That's why when you read the calcareous sulf symptomatic picture, you won't find any sensitiveness in calcareous sulf. Neither will you find any better by warmth in calcareous sulf, because it is not in that stage where the patient is sensitive, because it's already discharged. So that's one of the basic differentiations for any suppurative process when you were thinking of the related remedies. Next, please. Again, after Heper-Sulf stage comes the mercury stage. And mercury is a stage when now the pus is discharging, it's suppurating. For the woman's case, I had thought of bin iod, mercurius bin iodide, which is a mercury remedy, which is left-sided, which is suppurative, and by virtue of its iodum component, it can help in decreasing the size of adenomatous swelling. So if calcareous sulf hadn't helped, I would have thought of merc bin iod, because mercurius has the suppuration, left-sided. So mercury group of remedies do come in handy after the Heper and calcareous stage is over, calcareous sulf stage is over. And again, like calcareous sulf, mercury doesn't have any sensitiveness. What's important for mercury, however, is you can get a very offensive smelling discharge. So if that woman would have told me that discharge which is coming out is very bad smelling, is very foul smelling, there is a lot of thirst, there's a lot of salivation, there's a lot of perspiration, I'm worse at night, I'm worse from warmth of bed, I'm worse from perspiration, I would have definitely thought of mercury. I would have thought of merc bin iod in that case, considering the left-sided preponderance. But any suppurative process, irrespective of the side, mercury group of remedies will come in handy, minus the sensitiveness, minus the better from heat, which you have with Heper, which you have with belladonna. Here, the worse from warmth of bed, which is important for mercury. Perspiration aggravates them, night aggravates them in mercury. Again, syphilitic modalities, night aggravation. Perspiration is a general discharge, is a physiological discharge which aggravates for mercury. So post-suppuration, post-discharge merc-sol is always a go-to remedy. You come across silica after that. Silicea is another stage after mercury. But do always remember, mercury and silica are inimical. So one cannot follow each other well. There's always aggravation of symptoms whenever you prescribe one after the other. But silica does come in handy in cases of suppuration. If this woman would have told me that the discharge from that adenoma is a thin, watery discharge, I'd have definitely thought of silica. What is interesting, my friends, in cases wherever you come across suppuration, if the general nature of suppuration is always a thick nature, the general nature of pus is always thick. But whenever you read remedies, whenever you understand remedies like silica, you'll see and understand that it defies the general rule of suppuration. The general rule of suppuration, if you have a discharge, it's thick. But silica has a thin, watery pus. The term in the Materia Medica is thin and sanous pus. So that's very, very classical for silica. Sometimes you can have the pain in silica, splinter-like pain, like Heper, but there is not that degree of sensitiveness which you find with Heper-Sulf. Silica isn't sensitive. But again, chilliness is important for Silicea. Better by heat, you'll find with Silicea as well. But, considering the long-term suppuration, in case of Silicea, you'll commonly find is weakness as well. For that woman, whenever you're comparing remedies, it's always easier to understand. For her, if you thought of the debility, silica can fit the picture, great lack of stamina. But again, the nature of pus in silica is thin and watery. She was a hot patient. Silica is generally chilly. So, suppurative process before they are discharging, belladonna, Heper. After they have discharged, calcareous sulf, merc-sol, silica. But do always keep in your heads, merc-sol and silica do not follow each other well. There's some remedies which always interfere each other's action. If you give one after another. Bryanea, calcarea, inimical. I've seen lots of flare-ups whenever you prescribe calcarea after Bryanea. Phosphorus causticum are inimical. Again, a lot of flare-ups. Similarly, silica, mercury are inimical. So try and not prescribe. Apis and rustox are inimical. So try and not prescribe these remedies. Some of the commonest ones in our practice, which interestingly symptoms can come up one after the other. But it's always good to prescribe perhaps an intercurrent remedy between those and then prescribe the another remedy. So that's quite important to understand whenever you're trying to differentiate between the related remedies. Now, interestingly, in Nash has mentioned this, that whenever merc and silica are inimical, you can always give an intercurrent of hipersulf in between and then prescribe the indicated remedy. So you've used mercury, you feel the silica symptoms are there, give an intercurrent of hyper, then go to silica, and vice versa. So it's always better to give an intercurrent remedy and then go to the next one for prescribing. So those are few useful differentiating remedies as well. Few other remedies which can come up in this case for doing the comparative Materia Medica. Do remember a remedy called insulin. Insulin is a fantastic remedy which is used for a lot of weakness, a lot of suppuration, especially in diabetic patients. So you come across a diabetic ulcer, you come across a lot of weakness, and this kind of a non-healing ulcer in diabetic patients, you can think of insulin impotency, 30C and 200C. That's why I shared in the beginning, I got a blood test done and blood sugar was normal, negating insulin. Another remedy which can come up is in those cases of non-healing ulcers, senile ulcers, we call them, is tarantula cubensis. But tarantula cubensis, what is the interesting feature is there's a lot of atrocious, excruciating pain. But this woman didn't tell me any excruciating pain. Only pain she had was the tingling in her left arm and hands. But tarantula cubensis can come in handy in cases with senile ulcers, non-healing ulcers with atrocious, excruciating pains of death. That's a related remedy as well. Long-term suppuration, if it continues for a prolonged period of time, Myristica sebifera is another fantastic remedy. If you see in Bodice's Materia Medica, it mentions it acts more powerfully than hyperosilica, and it does away with the use of the knife. So sometimes the patient is contemplating surgery, contemplating removal of the particular tissue. Think of Myristica sebifera to help reduce the suppurative process, especially if you have prescribed hyper and silica in those cases. So that is a very important factor to differentiate between the related remedies as well. I shared in previous sessions as well, another fantastic remedy for a recurrent suppuration is staphylococcine. Staphylococcine is a superb nosode which is prescribed with good results for recurrent suppuration. So that staphylococcine also helps in those cases for recurrent suppuration. But again, if and when your well-selected remedy fails. So like a fistula, like an acne with pus, suppurating again and again, well-selected remedies aren't working, think of staphylococcine in those cases as well. 30C, 200C is the choice of potency in those cases for staphylococcine. Anthracinum is another remedy which can be thought of in these cases as well. But again, the Materia Medica, the comparative Materia Medica for anthracinum is the nature of the discharge is thick, black, tardy discharge, which is coming out from anthracinum. It's a thick, black, tardy discharge. So anthracinum will always have this kind of thick discharges, tardy discharges, which is important for differentiating with anthracynum. Anthracynum can have a lot of burning like arsenic, but the nature of the discharge is more like a hemorrhagic discharge in anthracynum rather than a suppurative discharge, which you had with her, which is important. Also, whenever you're trying to differentiate related remedies, with that kind of adenoma, iodum group of remedies will always come in handy. Any iodum group of remedies, whenever you're considering prescribing, if I didn't have the suppuration in the case, obviously I would have thought of an iodum group of remedies. baryta iod, calcarea iod, Kelly iod always work well in a hot patient with these kind of adenomatous growths. And if you think of the miasmatics, it's more psychotic. Sometimes the glands are affected, so it can be psychotubercular as well. And in those cases, iodine group of remedies always comes to your rescue with good results in these cases. So if there was no suppuration, just that adenomatous growth, Kelly, calcarea, baryta iod, I've had very good success in these kind of adenomas. Fibromas, lipomas work really well with these remedies as well. So always try and understand that whenever you are having scarcity of symptoms, even the particular symptoms, even the particular areas can give you the totality. My reason of prescribing calcareous salve was the nature of the discharge, thick and yellow. Sometimes we are throttling the patient for mental symptoms and dreams and delusions. But if you do not get it, it doesn't mean that you're a failure. You can prescribe even on the particular symptoms. And I've mentioned this time and again in various platforms that Hahnemann has never mentioned the totality of mental symptoms. Section 7 always mentions the totality of symptoms. What is the outwardly reflected picture? And there, if you have the thick, yellow, lumpy discharge, go ahead and prescribe calcareous salve with few calcarea, with few sulfur symptoms. And I'm sure you won't be disappointed. Thank you very much. I hope you are able to differentiate and understand the related remedies. I'll take up some questions now, please.
Yes, for sure. Thank you so much, sir. This session was indeed very informative. I would like to request all our dear learners to comment in the chat box with their questions now. We will begin the question and answer session in a minute. So while they are doing so, sir, can you please say a few words about the course that we have with you on THA?
Yes, I like to share that as well. We did miasmatic prescribing in 2019, and that has been doing very well on the platform on rapid classical miasmatic prescribing. Those who are joining in, those who have seen me earlier, you understand that my approach is not a theoretical approach, but I always try and share with you the practical ideas. And with miasmatic prescribing as well, I have tried to share how you can prescribe on the basis of miasms, what I can do, what you can do. So the course is entirely practical with a lot of information on the miasmatic classification head to foot. We have had miasms from different disease viewpoints, like a case of psoriasis doing a miasmatic dissection, a case of cystic hygroma doing a miasmatic dissection. So we have done that as well. And we have done miasmatics of the mind, the emotional component, so that it's easier to understand. Also, we have done the miasmatics of common ailments like cancer, like osteoarthritis, like gastrointestinal, asthma, so that it's easier to follow and understand whenever you're seeing patients. So that's one of the things we have done. I'm also starting a new program on Polycrests. I've always shared with you, I do not prescribe on the repertory. I do not have the time nor the opportunity to do that as well. So my understanding of prescription is based on Materia Medica, and I'll be sharing with you 25 Polycrests over the next course, or the next course launched by the THA, where I'll be talking about each Polycrest in details. And I always say this, you should know a Polycrest like a mother knows her child. From head to foot, from top to bottom. If you know and understand the Polycrest, you can always be a good prescriber. You do not need to, put on your computer and try and understand the repertory to prescribe. The repertory is always a dictionary. The Materia Medica is a language. If you do not know the language, the dictionary is of no use. So whenever you're prescribing on the Materia Medica, and if you know your Polycrest, and that's my idea of launching this new program, where we'll be talking about 50 Polycrests, 25 in the first course, 25 again later on, and we'll be going through each Polycrest in detail so that you understand and you can prescribe clinically to differentiate those remedies. So I think that will be a very good opportunity for people to learn as well.
Yes, sir, definitely. We are all waiting for your next course eagerly. So learners also, I would like to tell you that THA has a special offer for you. On the right side of the screen where you're writing your questions, there is an offer section and you can see the offer on the course of Learning the Art of Rapid Classical Miasmatic Prescribing by Dr. Saptarshi Banerjea on THA. That's a 20% off, for which you can use the code TS20 at checkout on our website. Please remember that this offer is valid only for 24 hours. So if you haven't enrolled in the course yet, this is the right opportunity. Please go ahead. All right. So, sir, we are already flooded with questions. Let's take some of them. All right. A learner wants to know, mental symptoms are of how much importance in these type of cases?
Frankly, it depends on what the patient is saying. If you do not get clear mental symptoms, or if you have spent some time with the patient and the patient is not giving you mental symptoms, it's no good throttling the patient. So you come across cases where the patient is a manual laborer, and you ask the patient, what do you dream of, or what food do you like to eat, and he'll smile and tell you, I only have the opportunity to eat dal and roti. So sometimes having those food desires and aversions and asking the patient about the mental symptoms and delusions is a privilege for them. So if you're not being able to come out with those symptoms, and if you have a clear totality on the particular and the physical plane, you can definitely prescribe on the basis of that.
Thank you, sir. Another learner wants to know, when a patient comes with suppuration, should we use lower potencies and wait for result, or we should go for high potency immediately for immediate result?
Like in this case, there was not much mental symptoms, suppuration. Even if it's there, you can always start with 30C. Lower potency, I mean always starting with 30C. And you can go higher. You can start with a higher potency, provided you have emotional symptoms in that case.
Thank you, sir. Another question from a learner is, what is the approach to severe hair fall after COVID-19? How can we approach them miasmatically?
Obviously, a good for post-COVID syndrome. I have a long video on post-COVID-19 syndrome. I've discussed on a lot of effects on that in YouTube is there, but a constitutional remedy is always best to handle that. Two remedies which you can think of for hair fall post-COVID is Thallium metallicum works well, as well as Mancinella. Those are useful remedies which work well for hair fall post-COVID. So you can think of those remedies as well.
Thank you, sir. Another question is how to approach a case of oral candidiasis when constitutional doesn't work.
Oral candidiasis, it's more like a whitish appearance of the oral cavity and the tongue. You can think of remedies from the doctrine of signature point of view, which have a whitish appearance. Antimcrude works well. Borax works well in those cases as well. I've had good success as a mouthwash with calichlor. So you can try that as well for those conditions in 6X as a mouthwash, calichlor.
Okay, thank you, sir. Learner wants to know, how can we repeat HEPAR when we need to give Silesia after Merck salt? So how it should
a single dose of Heparsol, 30C or 200C, that's an intercurrent prescription. Whenever you're prescribing as an intercurrent, a single dose is absolutely fine of the intercurrent remedy. And then you can go ahead and in a few days or a week time, you can go ahead and prescribe mercury or silica, whichever is indicated.
Thank you, sir. Learner wants to know about Hollerina. Can you explain?
Hollerina is a very useful remedy. Hollerina antidysentrica. It's an Indian remedy, Indian drug you'll find in the inner drug section of Boricae. And the remedy suggests is use antidysentrica wherever you come across cases of a lot of abdominal cramps, and there's a lot of mucousy stool, even diarrheic condition as well with loss of appetite. Hollerina works really, really well in those cases.
Thank you so much, sir. I think we are already running out of time and we have almost taken up all the questions. Okay, so let's take last question, sir. Cracks and fissures on tongue, and they are severe and not responding to nitric acid. What should be done?
Cracks and fissures on the tongue, my friend, is always a syphilitic condition. It's not always mandatory. If you do not have a constitution of nitric acid won't work, to be honest. But any syphilitic remedy, I've had good success with Calcaria fluorica, Calibic, Merck Sol. All those work well for cracks and fissures on the tongue. as those are syphilitic remedies. So look for the constitutional picture. If it's a syphilitic remedy coming up, try and prescribe a constitutional remedy based on those symptoms.
All right. Thank you so much, sir. I think it's time to wind up here. Thank you so much.
Thank you.
For such an informative and enriching experience once again, sir. A very warm gratitude on behalf of THA and on behalf of the BGen group.
Thank you.
And I apologize if I missed somebody's questions. I think I've tried to cover up all of them. Anyway, thank you so much, sir. Would you like to say something to our learners?
Thank you. Do enroll for the courses. Those are really useful ones. The miasm, and we're doing on Materia Medica about the Polycrests. I'm sure people will learn from those programs as well. So keep learning. Thank you.
Thank you so much, sir. Thank you everyone for joining in the homeopathic fraternity who are here today with us. And of course, Team THA, thank you so much, everybody, for joining. Thank you. Have a great evening. Keep learning, keep improving. Thank you so much, sir.